Don Quai is the dried root of Angelica sinensis. It's a plant belonging to the same family as carrots, parsley and celery. It's also known as Chinese Angelica. The plant is native to northwestern China, in the province of Gansu, and it also grows wild in the mountain areas of China, Korea and Japan. It's been used in traditional Chinese medicine for over 2,000 years. It can help with menopausal and menstrual symptoms. It can improve anemia. It's an antioxidant and an anti-inflammatory, and there's few adverse effects reported. In addition to other factors, menstrual cramps can be caused by high levels of inflammatory chemicals called prostaglandins and leukotrienes. A traditional Chinese herbal medicine with Don Quai relieved the menstrual cramps better than a placebo and painkillers in an analysis of 4 clinical trials that involved over 400 women. 4 grams a day of the remedy also normalized the irregular menstrual cycles in one small trial on 20 women. 2 other Chinese herbal mixes with Don Quai reduced menstrual pain in 2 trials on over 100 women, although they were ineffective during the first 3 menstrual cycles. Don Quai's component, lingustolide, prevented the uterine contractions in rats. This could explain its role for relieving menstrual cramps. Endometriosis is the growth of a tissue similar to the uterine lining and other pelvic organs, such as the ovaries and fallopian tubes. It causes menstrual cramps and infertility. A Chinese traditional remedy with Don Quai helped to clear this unwanted tissue in rats. Chinese texts describe Don Quai for deficient blood energy, with symptoms similar to common menopausal complaints, like irregular menstrual flow, nervousness, dizziness, insomnia, and forgetfulness. In a recent meta-analysis of 16 studies on almost 1,600 menopausal women, a Chinese herbal formula that contained Don Quai was more effective than a placebo and hormone therapy for improving the menopausal symptoms. Another Chinese remedy, which was taken at 3 grams a day, only improved the mild hot flashes in the clinical trial on 100 postmenopausal women. In contrast, 3 other herbal supplements with Don Quai reduced hot flashes and sleep disturbance in 3 clinical trials on almost 150 postmenopausal women. In premenopausal women, the surgical removal of the ovaries caused menopausal symptoms by dramatically reducing the estrogen and progesterone levels. A Chinese herbal mix with Don Quai improved the menopausal symptoms and restored the normal hormone, estradiol, luteinizing hormone, and follicle-stimulating hormone levels in a clinical trial on 69 women who'd undergone the ovarian removal. In traditional Chinese medicine, a prescription with Don Quai most commonly is used for anemia, and it's recommended to reinforce the qi, or the vital energy, and to nourish the blood by improving the body's circulation. 2 herbal mixes with Don Quai promoted blood formation by increasing the production of the blood-forming hormone erythropoietin. Additionally, its complex sugars protected the blood cells and reduced the production of hepcidin, a hormone that works to trap iron inside the cells. As a result, the herb might increase the red blood cells, white blood cells, platelets, iron, and hemoglobin. In a meta-analysis of 7 clinical trials with 460 people with anemia, a traditional Chinese medicine formula improved the effectiveness of the conventional therapy. Strenuous physical exercise can cause an iron deficiency by increasing the production of the hormone that traps iron in the cells, hepcidin. In a clinical trial on 36 men, the same traditional Chinese medicine formula decreased the iron deficit after a long run. The formula also improved anemia in rats and mice. Some herbal combinations include Don Quai have been found to improve the iron status in some studies. A severe complication of an infection is sepsis. It's a life-threatening condition where the body damages its own tissues. A traditional Chinese medicine injection for sepsis with Don Quai, combined with the conventional therapy, reduced the death from the sepsis in a meta-analysis of 16 clinical trials with over 1,000 people. The Don Quai also prevented death from sepsis in mice. A herbal complex with Don Quai and burdock reduced the infection of the bacterium that causes ulcers, Helicobacter pylori, in a clinical trial on 36 people. In rats with pneumonia, the Don Quai reduced infection symptoms. However, it failed to kill the bacteria that causes the disease in an antimicrobial test. In combination with other herbal extracts, the Don Quai prevented the growth of 2 bacterial species that cause infectious diseases, E. coli and Staphylococcus aureus. The complex sugars in the herb prevented the division of a virus belonging to the same class as HIV in mice. It also enhanced their immune response, increased their blood levels of T cells. Limited studies found a possible benefit of using the traditional Chinese herbal mixtures for bacterial infections. To add to its anti-inflammatory potential, a couple of studies suggest the Don Quai can be beneficial for ulcerative colitis, an inflammatory bowel disease. People who have ulcerative colitis have chronic inflammation and ulcers in the gut inner lining. The Don Quai injections relieved the symptoms in a clinical trial on 64 people. In rats, the herb and its complex sugars improved the ulcerative colitis and injuries in the stomach and the bowel. In a clinical trial on over 1,000 people who had a stroke, injections with Don Quai reduced brain damage and improved brain function. In animal studies, Don Quai and herbal mixes have been used to prevent and improve brain dysfunction that was caused by stroke, Alzheimer's, Parkinson's, aging, brain injury, and pain. According to traditional Chinese medicine, fatigue is caused by internal injuries from excessive emotions, overstrain, or an improper diet. The symptoms are similar to those of a qi deficiency and blood stasis, lack of appetite, weakness, and a failure to use and transport food nutrients. In a clinical trial on 36 men doing a long run, a Chinese traditional medicine with Don Quai shortened the finishing times by 14%. In mice and rats, the Don Quai increased physical endurance and it improved sugar, protein, and energy use. Excessive inflammation and oxidative stress underlie numerous diseases. Don Quai's anti-inflammatory effects have been suggested to help with diverse issues like menstrual cramps, arthritis, and ulcerative colitis. Its antioxidant properties might synergize and contribute to its benefits for reproductive, bone, skin health, as well as mood balance. It mainly works by preventing the activation of the body's inflammatory hub, the NF-kappa B pathway. Beyond this, it affects many other important pathways that reduce the production of the following inflammatory substances: the cytokines like TNF-alpha and interleukin-1 beta, interleukin-6 and interleukin-10, and messengers like nitric oxide, PGE2 and histamine. It blocks key enzymes that trigger and sustain inflammation in the body. In this sense, it's similar to the commonly used non-steroidal anti-inflammatory drug painkillers, but its effects are wider ranging. Free radicals damage the tissues by breaking down and damaging the building blocks of the cells. The Don Quai prevents this damage by increasing the activity and the production of antioxidant enzymes. Additionally, it triggers the production of a compound that helps cells to survive under oxidative stress, phosphodiethyl inositol. The main components with the anti-inflammatory activity are ferulic acid, ligustolide, and complex sugars. On the other hand, its main antioxidants are its phenolic compounds, while its complex sugars and proteins also contribute to the benefits. In an observational study on over 1,000 people who were using traditional Chinese medicine for depression and sleep disorders, a herbal blend whose main component was the Don Quai was most commonly prescribed. In rats and mice with depression that was caused by chronic stress, the Don Quai and ferulic acid improved the low mood. It reduced depressive behaviors such as drowsiness and immobility, and it restored the normal neurotransmitter levels of noradrenaline and dopamine. A herbal blend including Don Quai is commonly prescribed for depression and sleep disorders in traditional Chinese medicine, but in modern research this purported benefit has only been observed in rat and mouse studies. According to traditional Chinese medicine, blood stasis is the slowing or the pooling of blood due to the disruption of the heart qi. This syndrome is often understood as a blood disorder, and it might develop into a serious condition such as heart disease, heart failure, stroke, and clogged arteries. Free radical buildup can trigger the excessive platelet clumping. This is because the free radicals activate the release of arachidonic acid, and this is converted to a molecule that clumps the platelets. By scavenging the free radicals, a herbal mix with Don Quai prevented the excessive platelet clumping. Additionally, Don Quai reduces the production of fibrinogen. This is a protein that forms blood clots. Many active components in the Don Quai have proven anti-blood clotting activity. Don Quai and several of its components reduce blood clotting in rats and mice and prevented platelets from clumping together. However, the herb was less efficient than a conventional blood thinner. The herb improved blood circulation by reducing blood thickness, and this helps the blood flow more freely. It worked both alone or as part of two Chinese medicines. Raynaud's is a syndrome where the blood vessels become extremely narrow in response to cold temperatures. This causes poor blood circulation, numbness, and color changes in the fingers. A Chinese formula with Don Quai is traditionally used for this syndrome, and it's based on the belief that it warms the interior. In mice, this formula reduced blood vessel tightening in response to cold. The herb and its complex sugars protected rat and mouse heart tissue from the damage that was caused by poor blood flow, an anti-cancer drug, doxorubicin, and the main hormone that narrows blood vessels and increases blood pressure, angiotensin II. In menopausal rats, Don Quai reduced the bone loss that leads to osteoporosis. It had beneficial effects both alone and as part of two Chinese herbal preparations. A traditional Chinese remedy with Don Quai and this herb's active components reduced cartilage damage and promoted its repair in mice and rats with both osteoarthritis and rheumatoid arthritis. However, a different traditional remedy with Don Quai failed to improve the gouty arthritis in rats. Gum disease can destroy the tooth supporting cartilage and bone. Two herbal formulas with Don Quai promoted the regeneration of bone and cartilage tissue while preventing their destruction in rats and mice with gum disease. In rats, the Don Quai reduced the bone loss characteristics of osteoporosis. Other animal studies suggest a role for Don Quai in bone and cartilage health. In animal studies, Don Quai prevented and improved kidney damage that was caused by diabetes, poor blood supply, an autoimmune disease, and an anti-cancer drug. Don Quai's complex sugar protected mouse and rat livers from damage that was caused by Tylenol, from toxins like carbon tetrachloride, a harmful bean lectin, and a traditional Chinese medicine herb that can cause liver damage, the aeriam. When the body attempts to repair an organ that's damaged by chronic diseases, drugs, or surgery, it creates tissue scars. If proteins that form the soft tissue build up in excess, they can cause an organ to malfunction. In animal studies, Don Quai prevented and improved tissue scarring in the kidneys, the liver, and the lungs. Don Quai may speed up wound healing and reduce skin inflammation. It increased collagen production and it helped to create new blood vessels, both of which are required for proper wound healing. Numerous studies in mice, rats, fish, and cells attest to its ability to heal the damaged skin, either alone or in combination with astragalus. Additionally, the Don Quai improved skin allergic reactions and psoriasis in mice as part of 2 Chinese remedies. A diet high in sugars and fats can lead to obesity and insulin resistance, ultimately causing health conditions like metabolic syndrome and type 2 diabetes. Don Quai and a Chinese remedy containing it reduced weight, insulin resistance, and blood sugar and fat levels in rats and mice who are on a high sugar, high fat diet. In diabetic mice and rats, the Don Quai reduced blood sugar levels and complications, such as clogged arteries and pancreas, liver, kidney, and eye damage. It helped both alone and as part of Chinese medicine mixes. Don Quai and its components help kill cancer in cell-based studies. They could block cancer growth, maturation, and spreading to healthy tissue. The herb had a beneficial effect in brain, liver, leukemia, lung, colon, cervical, soft tissue and bone sarcoma, bladder, oral, prostate, and ovarian cancer. Additionally, 2 compounds from the herb might increase the response to cancer drugs. They blocked an antioxidant enzyme, glutathione S-transferase, the excessive production of which makes cancer cells resistant to chemotherapy. Not all components in the herb have anti-cancer activity. While its complex sugars and other chemicals kill breast cancer cells, ferulic acid stimulated their growth. This acid may have female sex hormone activity, which might feed breast cancer cells. The quality of many studies included in the meta-analysis was low. They generally had small populations, design flaws, and inaccessible data. Additionally, a lot of studies are only available in Chinese. Except for the menopausal symptoms, menstrual complaints, and anemia, very few uses of the Don Quai have been widely tested in humans. The studies for the following conditions included only have 1 clinical trial: sepsis, digestive infections, brain stroke, ulcerative colitis, and fatigue. The remaining health benefits had only been evaluated in animal and cells. Therefore, more trials in humans would be required to validate these results. A lot of the studies also use traditional Chinese medicine herbal blends, which combine Don Quai with several other ingredients. Don Quai is the root of Angelica sinensis, a plant in the same family as carrots and celery. The early clinical evidence supports the use as a menstrual aid. A traditional Chinese herbal remedy with Don Quai relieved menstrual cramps better than a placebo and painkillers in an analysis of 4 clinical trials. All other clinical evidence about Don Quai's traditional use is significantly less robust. Only a handful of studies have found the potential benefits for the menopausal symptoms, anemia, infections, gut health, brain health, and energy levels. But the evidence is either weak or conflicting. All other benefits have only been investigated in animals and cells. To book a consultation or to learn about herbs, supplements, and natural treatments, check out my website.